Hello again, we're here today to answer some more Q&A questions that are coming from my website. So we'll start off, Barbara's going to ask them, so let's start with question number one.
Okay, our first question is from Poppy. My nose is wide and I was wondering if Botox on both sides of my nostrils will help reduce the widening effect.
Okay, so we call that nasal flaring, and typically that happens with expressions. And so in some people it's more excessive and you can see this. So it's a treatment that can be, you can use Botox for to reduce that nasal flaring.
Oh,
Yeah.
That's a question that comes up a lot
Does it?
on the website,
I
yes.
don't think many people had nasal flaring.
Well, they're not only that, but they're self-conscious about having a wide nose. Okay.
Yeah.
Our next question is from Janet. She's 28 years old and has wrinkles under her eyes that are only visible when she smiles. That's with a lot of people, I notice. What treatment can I get to remove them, and what do you recommend?
So 28-year-old, typically you're seeing the starts of an aging aspect where the muscles are causing these wrinkles. So this is an ideal treatment for Botox, and we call it crow's feet. So at this stage, we're not really looking at fillers, but we are looking to also address issues moving forward to prevent these problems. So Botox is a good one, but I would also look at skincare and something she could be doing at home.
Yeah, that's good advice.
Yeah.
Teresa's 35 years old and is concerned about jowls. Is dermafiller the best option?
Jowls are best treated with fillers, but we're looking at a combined approach. Typically, the jowl is the formation here where we have loss of volume and descent of soft tissue to create that jowl. But there are other things happening here where you have lack of support between these two, the chin and the angle of the jaw. So one of the things that we would do is to look to lift and create a little bit of volume from the mid-face, but we would look to anchor here, and possibly if the patient has got any jaw retrusion, then you're going to support the chin too, and you can also be looking to contour the jawline with some filler as well. So it's a difficult treatment to get looking good, but it's very feasible and usually takes more than one session.
Okay.
It depends how bad the jowl is, and if there are other factors as well in terms of how much volume has been lost from the mid-face, particularly as we're going towards the ear.
You see, with some of the questions, people don't realize that it could be another problem. You always point that out. You may hate your chin, and you think you could go to a doctor and an injector to just fix the chin, but it's something else.
You have to
in
think of the
addition.
face as aging in totality. And so things that are starting to age elsewhere, they age at a different rate, and then they give different consequences. So you have to consider the whole face. It's not in isolation. One of the dangers, I think, in the past would have been where people had jowls and they would have been tempted to put fillers around the jowl to disguise it. And you end up just creating a much heavier look. We've gone past that. We're a bit more into treating more of the cause rather than the consequence.
Perfect. Well, that's it.
That's it.
Those are all our questions.
Well, if you have any more questions, please go to my website and submit them there through my email. Thank you.